Hi everyone, my name is Dr. Joyce. I'm a doctor working in London. I'm passionate about sharing my journey, health education, and so much more. And today we're talking about cervical screening and 6 important facts I feel like everyone should know about. The truth about cervical screening, also known as pap smears, is that it's one of those tests we'll have to do for the majority of our lives. In the UK, it starts at age 25 and it ends at 64. So it's important we talk about it because cervical cancer is actually the 4th most common cancer for women globally, and according to Cancer Research UK, 99.8% of cervical cancers can be prevented. So let's start talking about it. Here are 6 facts everyone should know about cervical screening. The first one is, where is the cervix? A lot of people still don't know where the cervix is, so it's a good place to start. So the cervix is the lowest part of your uterus and can be found at the top of your vagina right here. And the second thing is, what is cervical screening? Now, cervical screening is not a test for cancer, it's a test to prevent cancer. It checks for a virus called the human papillomavirus, also known as HPV. And if positive, the sample is checked for any abnormal changes to the cells of your cervix. Now, if there are any abnormal changes, we can treat it before they have the chance of turning into cervical cancer. So you're probably now wondering what exactly the HPV virus is, and that's my third fact for you. So the HPV virus is very common and it infects the skin and moist mucous membranes such as the cervix, the lining of your mouth and throat, the vagina, vulva, and anus. It's spread through sexual contact and most people are asymptomatic, which means that they show no symptoms. So most people don't even know that they have the HPV virus. We know of 200 types of HPV viruses, but they're usually split into 2. Low-risk HPV and high-risk HPV. And during the cervical screening test, we will test for high-risk HPV. And the 4th thing you need to know is what age to go for your screening program. Now, this may vary from country to country, but in the UK, it starts at 25 and you'll go every 3 years until you're 50 and then every 5 years until you're 64. Now, if you're 64 and you have never had a smear test, you can ask your doctor for one if you would like one. And if you live outside the UK and you're not sure about the screening programs that are in your country, please make sure you speak to your local doctor and they'll be able to point you in the right direction. The 5th thing you should know is what we use during your cervical screening appointment. So we actually use a speculum and a brush. And a speculum is a plastic tube that we place into your vagina to have a look at the cervix. And the brush is used to get some cells off the surface of the cervix. Now, it may be a little bit uncomfortable, but it shouldn't be painful. Remember that there are different sizes of speculum, so you can always ask for a smaller one. And the final thing is where to go for your cervical screening. So you can book an appointment with your GP in some sexual health clinics and even specialist clinics just for cervical screening. If you know in the UK and you're not sure where to go, please speak to your local doctor and they'll be able to point you in the right direction, as I said earlier. I really hope you found this video helpful and I hope it encourages you to go for your smear test when you're due one. Please make sure you remind your loved ones to go for theirs as well. If there are any other topics you'd like me to cover, please comment down below. Don't forget to like and subscribe, and I'll see you in the next video.